Hi everybody, I hope you're doing really well. I'm doing well. I just wanted to pop on here and give the part 3 of the medical malpractice, why I'm using a surrogate story. I wanted to make this a separate video in case somebody was uninterested in this and just wanted like the backstory of what happened. So if you watch those other 2 videos, I won't bore you with all the exact same details, but basically they left placenta inside of me. I was septic and then I bled out more or less and was really sick and nearly lost my life. And I did lose my fertility. They did a complete hysterectomy. So here we are now. And basically I was in the hospital. I was in the ICU for a while. And then I was in, like a regular medical surgical recovery floor for a while as well, much longer than I was in the ICU. And basically I had to have a lot of transfusions after that, and I had to have tons of antibiotics, big time antibiotics, like multiple. And those, along with pain medication, because I had just had, this was a surgery in the same place that I had just had a surgery, my C-section. So I had like another, a wound again after they ripped open the same or cut open the same wound that I was healing from my son, and it had only been 5 weeks. So it wasn't really even healed all the way. And my body never really healed properly anyway, I think because it was so sick. So I think normally 5 weeks out, I probably would have been better off than I actually was. But the recovery, like once I got on all the antibiotics and once they started treating everything to get my body back normal, I started to heal physically, like the scars, pretty quickly. I'm not gonna say that I'm not mangled, I think is the only word I can kind of use to describe it. My stomach will never be the same. And I know that that's kind of like, duh, you did have 2 C-sections, I get that, but after my second C-section, they actually like pulled the skin nice and tight, and my scar and everything, my stomach looked good. It was like almost flat, obviously I still had like baby weight and stuff, but the skin itself, they had pulled it so nicely. They even trimmed the scar from my last one and had it, it was just really nice. Like they did a really good job. So, but when they had to do the emergency surgery, obviously they weren't worried about like cosmetics, which understandable. That's not their priority, nor is it mine. So anyway, so I'm in the hospital at this point, and I just wanted to throw this little part in there. The doctor who delivered my son, so the one who did all of this, more or less, she's the one that left the placenta in. She was the delivering physician. This was her fault, I guess. That's what I'm gonna say. But she came in and saw me after I don't know if I was in the ICU. I can't remember where I was. I was awake, so I was better than I had been previously. She may have come in before that and I was asleep, I don't know, or unconscious, whatever. She came in and I remember her sitting on the edge of my bed and she was bawling. She was crying her eyes out. She just was hysterical, just apologizing. I'm so sorry I did this to you. I'm so sorry. And what do I say, right? What do I say? It's okay. Look at me. Look at me. Like I've got drains in and out of me. I've got a PICC line. I'm not the same. I'm extremely ill. What do you want me to say? Like, I get that she's apologizing, and I appreciate it, I guess, but I don't know how to respond, right? So I'm just like, she's like, I'm sorry. And I'm like, yeah, I don't know. So, and that's actually the last time I saw her. After that, I have not seen her again. So, the doctor who ended up saving my life was the one who kind of followed me from there. She's the one I still follow up with, actually. And so she came in a lot. We almost became like friends. I guess that's what happens when somebody saves your life, whether it's their job or not. It's a special bond. And I don't know if I mention this, but when I finally did wake up for the very first time after all this, she was at the foot of my bed as well, in my whatever room I was in, crying. And she was just like, I'm so happy you're here. I didn't think I was going to see you open your eyes. Like, she was emotionally invested in me, and so I'm emotionally invested in her. How can you not be? So, like I said, I'm on all these antibiotics. I've got the PICC line. I've got all kinds of tubes and wires coming out of me. And, it was a long road in there. My husband was wonderful and brought my son in all the time because I was still I was pumping and dumping some of the time just because I was on so much stuff. And I know a lot of it doesn't transfer, but some of them, they told me, like, don't breastfeed right now, right? Because some of the medications they were using, some of the antibiotics they were using, when they initially, like, didn't know what was going on and they were kind of just, like, trying to save me more or less, were, what they said was, it's the type of antibiotics that they bring to like wars and battlefields when people get gangrene from, like, getting a wound that gets infected and dirty, and or even in other countries where it's almost like too late, you know, like where they have to just kind of like the big ones. I can't even think of what it's called. I can't think of it. I don't want to say the wrong thing. But they gave me that, which in combination with everything, in combination with the medications they gave me during surgery, in combinations with all the recovery medications, I went into kidney failure. And what that looked like for me was I had, like, physical kidney pain, which I'd only ever had one other time in my life when I had, like, a kidney infection. And I got that when I was doing IVF. So it had been a while. And you know it, like, once it's happened once, you know it. You're like, that's a weird place to have pain. And the ways that when it would hurt and wouldn't hurt, like, I just knew that it was. So I said to them, I was like, I think I have a kidney infection, but I was getting fluids and I had a catheter at the same time. So, I was being flushed. It's not like I was, like, trying not to pee and holding it in, or, like, not getting enough fluid and being dehydrated. Like, they monitored all that. And so it was strange that I had that. So of course they did ultrasounds and then kidney function tests, and they discovered that I was in kidney failure. So that kind of changed my course of medication, of course, because there's certain things your body no longer filters out properly when that happens. And so everything kind of had to be dialed back. And when I did get discharged home and was going every single day to an infusion clinic to have my antibiotics given to me, which was, like, a total joke. And like, I don't like to be critical of places just because I'm, like, was in the medical field, because I know that it's not fair to have, like, those kind of standards, but in anybody's standards, it was a joke. Like, I had to ask to have my blood drawn, because what you do is, like, you go in, and it's like a protocol. It's whatever you're supposed to be getting is an order that they have, and then every so often they're supposed to be taking blood work. Number one, to make sure it's working. Number two, to make sure, especially in my case, that the medication they're giving isn't hurting something. They're supposed to be taking my temperature every day to see if I was to spike one. That means that isn't working and I have another infection, which happened multiple times. I would ask for them to take my temperature and I would have a fever. They would call the doctor, and then they'd have to tweak something. And so, that was just kind of like, I wish I would have, I didn't think enough to, but I wish I would have asked to have home health, like have a nurse come, because my insurance would have covered it, come to my house and give me the medications instead of being in this place, because it was really dirty, and I watched them not use gloves when they were going from me to the next patient, and it was just like, all of these people have infections most likely, or they're on chemo. Either way, they shouldn't, it's universal precautions anyway, but you need to be extra careful for these people. They're not all 27 years old and whatever. Most of these people are elderly, and you can tell they're very sick, and they're all exhausted, and some of them are there for 12 hours a day. And so, whatever. Moving on. So I don't remember how long I've tried to, like, move on mentally from this. So I think my way of doing that, my coping mechanism, is just, like, repression. So I just push it down and, like, not think of it. And once that happens, it changes how much I remember. I guess it's like with anything else, even though it hasn't been that long. And I remember lots of stuff surrounding that, like about my son, where I was focused. I didn't want to store that one, these memories as vividly as some. So I'm going to try to be as accurate as I can. But so after I was done with all the infusions, the daily infusions, and they released me, they said, you don't have an infection anymore. I still was on medications for my kidneys. I still am on medications for my kidneys, but that, obviously it's still continued till now, but that was probably one of the hardest things because there's so many restrictions, fluid restrictions, diet restrictions. I'm a salt addict, and that obviously, if you know anything about your kidneys, you know that that's one of the big things you've got to be careful of. And so everything changed. Not only that, aside, in a different way, I still to this day have chronic pain in that area, in my whole abdominal area and my lower abdominal area. And that's, like I said, they did hit my stomach when they were in there. They also did hit a nerve. And that's the nerve, for sure, that I feel. But that one, you almost it's expected. And so, it's a very pinpointed kind of pain. But the generalized ache, I guess, is what, I never can really get used to, because the only way I can describe it, I don't even know how to describe it, honestly, the way it feels, because it's not like a period cramp or a contraction or whatever. It's very different. It's almost like a numb burn. Oh, I don't know. If your foot ever falls asleep and as it's waking up, that unbearable, oh my God, just stop already. That's how it feels in my stomach, all the time. But it's worse other times than some. Sometimes it's like one of those things where you tolerate it so much that it's normal, but there are some moments, right when I first wake up in the morning, or I've been laying flat for any period of time. I guess that because everything is relaxed and stretched out, it's the first time I use my abdominal muscles, and move everything around in there, whatever's left. That's when I'm I've started to just automatically brace myself, and I will roll rather than just hoist myself up to get up from laying down. You just adapt. And so that's definitely different. So the dietary restrictions were a big one, obviously, like I mentioned, and then, the new way I have to move my body. But the other thing was I don't have periods anymore, which you would think would be a good, it is. That's a good thing. It's not a monthly reminder that I can't have children anymore, but what goes along with that is menopause. And to do that at such a young age, at any age, I'm sure it's really difficult, but I was not ready. So I'm healing, and all my hormones are going crazy. I can't be on artificial hormones not artificial. They can't prescribe me hormones because of the, my genetic blood disorder that I have. It would cause blood clots, any estrogen or whatever. So synthetic hormones, that's what I was thinking of, sorry. And so I just deal, and in the grand scheme of things, it's really not this unbearable situation, but it is really, really different. It's, everything is different when that happens. You know what I mean? Anybody who's gone through the change will tell you, and especially when it's so radical. After my body was still healing from pregnancy, breastfeeding after that was really, really, really hard. And it's not I can take things to supplement, because of my kidneys. It's this huge cycle of how this affects this, which affected this, and this is, you know what I mean? It's it's crazy. So all of that. And then I would say the worst of the worst, if none of that mattered, if none of that was important, the mental side of what happened to me was the worst of the worst. I mentioned it briefly, but I could do a whole video just about the PTSD that I've, from coming so close to dying and having everybody around you remind you of that. And I'm not saying they shouldn't, but just to constantly be reminded of how, looking at my own body and looking at my child who constantly reminds me of what happened, and taking medication every day that reminds me of what happened, going through this whole surrogacy process with the unknowns because of what happened to me. The anger was, I guess still is, just something it's hard to get around, and feeling at any moment, I could, even me, you think oh, I'm invincible, nothing can happen to me. Even me, I could die. And it's just so easy that, you think it would be some difficult feat to nearly pass away, but it's easier than you think. And which is just mind blowing, right? Because I've also lost people close to me, which have reminded me, I guess, or put an extra emphasis on how easy it is, and how precious life is. My mom passed away when I was 17 years old, and you'd think after something like that, you'd realize how precious life is, and seeing, bringing life into this world. But it takes a whole new meaning when it happens to you, or almost happens to you. And and then what else happened after that is the relationship between my husband and I changed. And I don't know if it's for the better or for the worse, but his mechanism for healing is, I could lose you at any moment, and I'm gonna act like that. And I'm not condemning him, because I don't even know how I would have been able to deal on his end of things. But it changed everything. It changed the way that he treated me, rightfully so. I mean, he watched me almost disappear from his life. So, that changed. Like I said, I was treated like glass for a long time, and then I think, you feel almost temporary, because that thought is in the back of your mind, like, this could be my last day. Even though I'm not sick anymore, it just is constantly there. And I don't know if that's like totally normal for everybody who has like a near-death experience, but it was for me, and it certainly was for him. And even feeling that way towards other people in his life, our sons. I mean, he is like, I feel like anything could happen to them at any moment, which is partially a normal parent thought, like, oh, I have to prepare for everything and protect them from everything, but more in like, something could happen at any moment, and I need to be prepared to lose them, kind of like mentality. And not like blatantly so, but definitely, part of that. So I don't want to ramble too much longer about how the difference is, in my life, because I feel like that kind of says them all. And I'd be happy to talk more about, like, just do a video about my mental health and like what I did to kind of cope. But I do want to talk to you about the legal side of things, and believe it or not, it's a short story on that end. And this may blow your mind, because it still blows mine to this day. So I am going to attempt to talk about this without getting angry. But so originally, following everything that happened to me, I was not thinking like, oh, I should sue somebody. Like, I was just happy to be alive, and I thought they did me this wonderful service, saving my life, because I'm thinking like, it's the same practice. The doctor who delivered my son and left, neglected to take the placenta out of me fully, is the same practice as the doctor who saved my life. So I'm like, oh, I can't sue the practice. I can't sue her. It'll take the other one down. And I was thinking, plus I'm just not that type of person. If there is a type of person who sues people, it's not me. And so I didn't even think about it. But enough people, including another physician who is an OBGYN, told me, like, you're gonna like seek legal repercussion, right? And I was like, I kind of felt pressured too. And then, but also, like, I kind of felt like it kind of started to make sense, especially considering we still had these embryos and we wanted a way to bring them to life. And I thought that we would need, if nothing else, just pay for that. I wanted that to be taken care of. Why should we have all these expenses when this wasn't my fault and my plan was to carry my own children? So that was my thinking. Like, that's what I came to. It's not about, I don't want to live, free and clear the rest of my life because this happened, because I'm here and I'm way better off than most. So we talked to a total of 4 lawyers, and then one like legal aid company kind of thing, where you don't speak directly to a lawyer, but it's somebody who like gives you advice. So, and I'm not gonna go into super long detail about everything, but we told them our whole story, all of them, 2 of which you had to just like write it via email, or like a statement in about what happened, and they would review it and like send an email back. 2 of which I spoke to, like, one was over the phone, mouth to, like I spoke out loud, and the other one I went to see. All of them would not take my case, and here's why. 2 of them just said, no, we're not interested. The 2 that I emailed were like, no. It was like a form letter they sent back. But the other 2 kind of told me why. So basically what we were told is, because we already have children, and even though I did lose my fertility, we already have children. So also we are like considered like wealthy, or you know what I mean? Like we're not destitute, I guess. I don't really know what to call that. We're fine monetarily. And because I didn't die, they said that no jury would feel bad for me and that I would not win. So I either had to die, we had to be totally out of money with no other options, or we had to not have any kids, and like, we have kids, we should just be happy that we have those and figure out what to do with the other ones, So basically because of our privilege, is what they said, like verbatim, because we are privileged, nobody would feel bad for us. It would be really hard to find a jury to, to choose in our favor because of our privilege. I don't really know what to say about that. I kind of felt like, fine, it's not meant to be. You guys can make your own decisions about how you feel about that. I'm sure you can imagine that was really hard for me, because while I do feel so lucky, and we are like in a really good place, and blessed, obviously, like we're very favored, whatever. It doesn't, why is it any more fair for somebody who is poor or whatever I don't know, why is it any more fair? I just feel like, why not? After everything we've been through, and my family's been through, my children have been through, why is it any better served for somebody else than it is for us? So my thinking is, God knew what he was doing, and if that was meant to be, it would have been. And obviously it wasn't, and to fight to try to get some restitution for something isn't me moving on, and it isn't me closing that door, and it isn't me healing. So that's it. If you have any other questions about it, I'd be happy to ask. But we basically are done with that. We're not seeking anything further in that department. We are doing what we can do, and we're having peace with the rest. And a lot of people like to say, oh, keep going, keep trying. But 4 is a lot of lawyers. 4 is a lot. It's not like it was 1 or 2. It was like best out of 4, and it was 0 for 4. So the other thing, somebody did ask this after the last video I put, and I just wanted to mention it briefly. I told you guys what's different for me and how I kind of handled it all, and I told you how my husband, but my son was also 6 years old, and he was old enough to know what was going on, and he was old enough to know that his mom was going to die, because that's what we thought was going to happen. So he said his goodbyes, thinking that was what the end was going to be, like the outcome, and obviously it wasn't. So, and he also knows that I lost my mother, and he, for a while, took a lot of convincing to realize that you don't automatically just lose your mom when you're young. Sometimes you can see your mom go into old age and have grandkids be introduced. He didn't understand that, but he understood enough that he was not going to have me anymore. And I think, obviously we've had a lot of talk since then, and he doesn't worry as much anymore, but for a while he was really, and he had just started kindergarten. It was hard. It was so much change at one time. He just had a new brother, it was a lot. So it's taken a lot of conversation and a change in my relationship with him, just because it's made me appreciate and also realize how he feels, how hard that must have been and how scary that was. And that's never going to leave him, I don't think, fully, because 6-year-old memories are stored memories at this point. So I just have to kind of respect that and be careful of what I say, because you always say things like, oh, I would kill for this, or oh, I would just die for ice cream, or whatever. And I cannot say that stuff, even in a not serious tone with him, because he does not. It's not like he'd be like, oh yeah, haha, I get it. He's not there yet. He's almost 8, but he doesn't understand that while life is not permanent, it is not automatically temporary in that respect. So anyway, if you guys have any questions about that, I'd be happy to answer more. I hope I got the point across in it, and as frustrating as it is, that's what happened, and that's the reality. Thank you guys for sticking around this long. I know this is my longest video yet, and if you made it this far, you're awesome. Thank you so much. I really care about you guys, and I really appreciate you listening to me. I hope you have a great day. See ya.